welcome to the National Emergency Response Committee on Coronavirus, an update with regard to our country response measures as of 29th May 2020. This is our 72nd brief. Fellow Kenyans, the high figures that we have been recording in the last few days are a function of our increased sample size in terms of testing, and two, the fact that the virus is firmly in our midst and that we have established community transmission. We can stop this if we all cooperate together and deal this monster a fatal blow. The silver bullet that is needed to do this is largely behavior change, an internal drive to observe the various restrictions and practice the containment measures that have been advocated for by the Ministry of Health. We have also observed a worrisome trend. There are individuals who are using unofficial routes, these are panya routes, to get in and out of restricted areas. And we would like to remind such people that Nairobi and Mombasa are currently the counties that have the highest number of infections, and therefore sneaking out of these areas is equivalent to sneaking the virus into other counties. And those engaged in this practice may think that it is heroic, but it is important for them to remember that they have simply taken the virus to their families and friends. And we therefore caution them to take action and to ensure that we are vigilant as a community and that we are able to report to the police anybody who may have recently traveled from Nairobi or Mombasa. And this is necessary for us to be able to contain this pandemic and to ensure that each and every Kenyan takes personal responsibility in this fight. We have equally noted a cavalier attitude in some of the people in various estates, particularly here in Nairobi, where we've noted that people have thrown caution to the wind, and for some individuals, life is back to normal. Containment measures are being discarded in matatus, boda-bodas, in some supermarkets, and in some banking areas. And we would like to remind our people that the situation has not stabilized. We are glad that people now are turning out for targeted testing, and this is encouraging because it is the only way we will know where the virus is for us to be able to take action against it. And we therefore continue to urge people to willingly present themselves for testing. We would also like to add caution that when you do receive a negative result, this is not a ticket for you to ignore the containment measures, and that one can easily contract the virus immediately after getting a negative test. And so we must remain cautious at all times. With regard to our COVID-19 situation, we have recorded another high of 127 positive cases out of 3,831 samples tested. We therefore now have confirmed 1,745 positives in the country. The cumulative tests conducted so far tally to 74,003 tests, and all except of today's positive cases are Kenyans. These cases are spread as follows. In Nairobi we have 76, in Mombasa 19, in Busia 16, Uasin Gishu 8, Kiambu 2, Kajiado 5, Isiolo 1. And the distribution of cases by counties is as follows. In Nairobi, we have 49 in Kibra, we have Ruaraka having 13, Makadara 4, Westlands 4, Langata 2, Embakasi West 1, Kasarani 1, Dagoretti North 1, and Starehe 1. In Mombasa, the cases are as follows. 7 from Kisauni, 6 Mvita, 3 Nyali, 2 Likoni, and 1 Jomvu. And out of the 16 cases in Busia, 8 are at Busia, whereas 2 at Malaba points of entry, and 6 are at the Alupe quarantine facility. The cases in Uasin Gishu are all from Tabo, while in Kajiado, the cases are from Kajiado North, and the Namanga border we have 3 cases. In Kiambu, 2 cases are from Kiambu town, and 1 from Kabete. And the case from Isiolo is from Isiolo town. Therefore, our numbers continue to rise. We are also glad to inform you that we've discharged 17 patients from our hospitals today, bringing the total number of recoveries to 438. and we therefore continue to appreciate the good work by our healthcare workers. However, we are saddened again to report that today we have lost 4 more patients to this disease, and all of them are from Mombasa. And as we've previously emphasized numerous times, again, a similar situation has occurred out of these 4. They all have underlying conditions such as hypertension, diabetes, and asthma. And therefore, we do call on to all fellow Kenyans who may be having these underlying conditions to ensure that they are managing their conditions well and that they're taking their medications and maintaining healthy lifestyles.